I got my eye injured with a nail, and then I like there was a lot of pain, and I thought that the pain will go away after a few minutes, and then it didn't happen. So then I had to I lied. There was a sleeping time, so I lied. I went to sleep, but all of a sudden I started feeling very much pain, a lot of pain in my eyes, and then we had to rush to the emergency. My family took me to the emergency because I was totally unable to open my eye, and also there was a lot of pain. So in the emergency also, they upon entrance they asked me to open my eye, and then I opened my eye a little bit, and with lots of effort. And then the person, the doctor or the nurse who was attending me over there, she said, "Can you see me?" Then I said, "Okay, yes, I can see you," and it was open a little bit. So I thanked, like I was very much happy that I can see. And then they put me in the waiting area, my wheelchair, and then I had to wait there almost about 20 minutes. And then they took me to the treatment area, and then I had to wait for half an hour. No, it wasn't half an hour, it was about 45 minutes. And then the first resident doctor came, and he performed some he asked my history and my symptoms, and then he performed my, like, he asked me to open my eye, and then performed a dye test, put some dye in my eye with the injector, and checked it with the lens. That dye, with that dye, the corneal, the upper layer of the eyeball, which is called cornea, which is a protecting layer like over this black area. So that is stained, and that can be that we can see with the doctor or the medical personnel can see with their special testing lenses, and they can see that is a magnifying sort of kind of glass in that mirror, handheld mirror. So with that machine, they saw that there is an injury over the epithelium of the eye. And then and before doing the test, the numbing medicine was put in my eye. So the after the numbing medicine, pain was relieved a lot, like I was able to open my eye, and then stain was put, and then test was done. So and after that, I was able to see and open eyes comfortably without any pain. And then after almost 20 minutes, emergency physician came, and she told me about she asked me about the condition, and she told me that I'll be given antibiotics for my eye, that I have to apply for 7 days, 4 times a day. And I have to visit ophthalmologist, eye specialist, within 2 to 3 days. And then she went away, and then I was performed eye vision test. And in a different area, I was taken to the different area for that, like of the same trauma area. But I there where there was a setting for eye tests. And then after upon discharge, while like the numbing medicine effect went away after about 40 minutes, and then I started the pain again. And I had asked my resident, my emergency physician, that while going home I should be given the pain medicine again. So I told the nurses or the ward boys over there that I should be given that medicine again once more because I started pain. Also they said okay, okay, I'll give. But then all of a sudden the pain started very much, like it was a terrible pain again. Then they saw, then they gave me just one drop in this eye. The pain relieved for half an hour more. But after coming home, I was discharged, and after coming home, the pain started again. So I spent that, I went to sleep, yeah, and somehow for some hours, and then then in the morning, I had to go to the urgent care, where they redo my dye test again, for seeing the extent of the corneal abrasion. And then they prescribed me after giving the numbing medicine, obviously. And then they prescribed me the painkiller drops as well, because that was not given by the initial doctor. And the numbing medicine was very much effective, and I requested them to put it again, for because the pain was too much. Mm. So better to be careful, because it's very painful. The corneal abrasion eye is very much in pain, and emergency they just do the initial management. And the person who is going through the pain, or something, only that person knows it.